The two main pieces of equipment for total knee and total hip replacements is a rolling walker and cane. Your walker should only have wheels in front. Walkers with no wheels or ones with 4 are dangerous after this type of surgery and may cause a fall. Your cane should be adjustable. If it's not at the correct height, you can slowly hurt your back. It should also be a single point at the bottom. Canes that stand up on their own are not recommended as they cause a higher risk of tripping and can perpetuate a limp. Each insurance company has their own policies on what equipment they'll cover. You may call your insurance company in advance, or our care team can assist you once you're in the hospital. It's sometimes less expensive to purchase these items in advance depending on your insurance plan. If you need a cane or walker, we have them to dispense here at Midstate. They'll be billed through your insurance. Commodes or raised toilet seats are encouraged for posterior total hip replacement patients so that they can maintain their precautions. However, if your toilet is very low, any patient can request these items and we can verify insurance coverage. Please note that insurance authorization and delivery can take several days. If you think you need a commode, consider buying one ahead of time through an online retailer or a medical supply store before your surgery. A hip kit is also recommended for posterior total hip replacement patients to maintain precautions. These are not a covered item and must be paid out of pocket. It's possible to purchase this item through retailers like Amazon or medical suppliers. A hip kit should include a reacher, sock aid, long-handled sponge, long-handled shoehorn, and elastic shoelaces. These items can also be purchased separately. Our occupational therapist will help you learn how to use these tools. When it's time for you to leave the hospital, you'll have a transition folder. It'll have all your medical instructions for wound and dressing care, showering, activity, your medication regimen, and your prescriptions. Some surgeons may have prescribed your discharge medications before surgery to your local pharmacy. Keep these at home so they're ready when you return home. Your nurse will sit down with you and your coach to go over all of your instructions. If you have any questions or concerns after returning home, you should always check with your doctor, but your folder will also include the phone number of the orthopedic navigators. We are an additional resource for you to utilize. When it's time to leave, our staff will help you into a wheelchair and bring you down to the entrance where your ride will be waiting. Recovery is different for everyone, and many people are able to return home, do exercises on their own, and go directly to an outpatient location for physical therapy. If you transition directly home, we may arrange for a home care agency to come work with you depending on your recovery progress and ability. You may choose which agency is used. If you don't have a preference, let your case manager or navigator know, and we can give you choices of which your doctors recommend. If you plan on staying with a friend or family member, please make sure you provide us with their address so that we send the home care staff to the correct home. Home care is essentially physical therapy at home. They visit a few times per week until you're strong enough for outpatient therapy. We'll provide the agency information in your discharge packet as well as discuss it with you prior to you leaving. There are usually very limited nursing visits depending on your needs. Though occupational therapy or home health aides are not normally requested, we can do so if there is a medical need and your insurance provides coverage. If you'd like to pay privately for additional help, our case manager can assist with that. Short-term rehabilitation is rarely needed after joint replacement surgery. Total shoulder replacement patients don't often receive home care services. If our therapist is concerned about your mobility or safety, we may send a therapist to your home once or twice for a home safety evaluation. Most often, though, you'll wait until your surgeon allows you to go to outpatient therapy. If you start with physical therapy at home, you should be able to go to outpatient therapy after the first 2 weeks. You may go to your surgeon's office if they have a physical therapy department, or anywhere else you may choose. How long you're in an outpatient therapy depends on how quickly you improve. Your surgeon and therapist will make that decision. As each insurance policy is different, we recommend you call your insurance benefits line and ask how much physical therapy is covered by your insurance plan. Please make sure to also ask if those visits also include the outpatient therapy. There are certain policies that combine both home and outpatient services. After transitioning home, our nurse navigators will be calling you periodically. We want to answer any questions or concerns you may have as you recover. Most of all, we want to assist you so that we can prevent any unnecessary return visits to the hospital. The orthopedic navigators are there for your support. Please call them with any questions or concerns as you prepare for surgery and afterwards throughout your recovery. We also use a patient platform called Force. This program can be accessed on mobile devices or with a computer. It provides an email communication tool with the navigators, provides reminders and education, and also collects some needed information on your joint replacement and progress. Several of these questionnaires are collected after surgery and are required to evaluate your progress as you recover. The most important ones are collected 90 days after surgery and again 1 year after surgery to review how joint replacement surgery improved your ability and quality of life. We are honored that you're choosing and trusting the Connecticut Orthopedic Institute for your orthopedic care. We hope you found this information helpful. We look forward to meeting you and delivering a world-class, exceptional experience.